Hello there! Today we are going to talk about smoking, vaping, lung cancer, and pulmonary tuberculosis. So, first, smoking. Did you know that tobacco kills more than 8 million people each year? More than 7 million of those deaths are the result of direct tobacco use, while around 1.2 million are the result of non smokers being exposed to secondhand smoking. According to Global Adult Tobacco Survey in 2015, 13.1 million of adults smoke tobacco daily. Overall, daily cigarette smokers smoke an average of 11 cigarettes per day. The overall average age of initiating daily cigarette smoking is 17.5 years old. So what are the adverse effects of smoking? Estimates show smoking increases the risk of coronary artery disease by 2 to 4 times higher, strokes by 2 to 4 times higher, peripheral vascular disease 10 times higher, chronic obstructive pulmonary disease mortality by 12 to 13 times higher, and lung cancer, wherein in men it's 23 times higher and in women 13 times higher. Smoking damages blood vessels and can make them thicken and grow narrower. This makes your heart beat faster and your blood pressure to go up. Because of this, clots can form. Strokes may happen if a clot blocks the blood flow to part of your brain. Smoking can also cause lung disease by damaging your airways and the small air sacs, called alveoli, found in your lungs. Smoking contributes to at least 15 types of cancer in the lungs: esophagus, larynx, upper throat, mouth, nose and sinuses, liver, stomach, kidney, pancreas, bowel, ovary, bladder, cervix, as well as cancer in the blood called leukemia. Vaping. Vaping is a small handheld device that heats up a liquid to create a vapor that you inhale. So what are the myths and facts of vaping? According to others, flavored vapes are just harmless water vapor and may not contain nicotine. So the fact, vapes contain chemicals such as nicotine and other toxins including formaldehyde, lead, and nickel. So these components are harmful. Another myth is that vapes are not addictive. Fact, vape contains nicotine. Nicotine is a highly addictive substance and can affect the developing brain. Myth 3. Vaping devices are safer than conventional cigarettes. Fact, vapes are harmful. The vapor produced can cause damage to your heart and lungs. Nicotine in vapes can cause a rise in blood pressure and adrenaline levels, which increases your heart rate and the likelihood of having a heart attack. So what are the long-term effects of vaping? Vaping can damage lungs by the release of free radicals, which can promote cancer development. Vaping can also cause the weakening of the immune system. Vaping can cause delay in brain development of fetuses, children, and teenagers. So how do we quit smoking and vaping? First, quit. Don't switch. Some smokers may think that e-cigarettes will help them quit, but substituting one addiction for another is not quitting. Second, find the reason to quit. Why do you want to quit smoking in the first place? Knowing why you want to quit is an essential step in the process of quitting and can help you get motivated when it gets tough. Third, understand what to expect. Quitting smoking is a journey, not a single event. Knowing what to expect can help you along the way. Fourth, you can get professional help. Counseling can double your chances of success and including a medication to your tobacco treatment plan. Fifth, combining medication with a behavior modification program can yield the best results. Changing your own behavior is necessary. Always remember that the only person that can save you is you. Lung cancer. Lung cancer is the uncontrolled growth of abnormal cells that starts in one or both lungs. According to World Cancer Research Fund International, lung cancer is the second most common cancer worldwide. It is the most common cancer in men. On the other hand, second most common cancer in women. Lung cancer is also one of the deadliest forms of cancer. In the Philippines, it is the fifth leading cause of death. According to WHO in 2020, lung cancer in the Philippines take away 10,296 lives. So what are the risk factors of lung cancer? First, lung cancer is also hereditary disease. It can be passed from one generation to another. Second, cigarette smoking is by far the leading risk factor for lung cancer, both in smokers and in people exposed to secondhand smoke. Other risk factor is exposure to radon, which is a colorless, odorless, naturally occurring radioactive gas that occurs naturally in the soil. Secondhand smoking exposure, asbestos exposure, and air pollution. Although you may not be able to avoid breathing air pollution, you can be active in your community to take part in reducing this phenomenon. So how does lung cancer develop? The pathophysiology of lung cancer is very complex and incompletely understood. Carcinogens like cigarette smoke, radioactive agents, pollutions, and other agents can bind with the cell's DNA and damage the cells. This can result for the normal cells to be transformed into abnormal cells. This can cause abnormal growth of the lung cell tissue, causing cancer. So what are the most common signs and symptoms of lung cancer? First, a cough that does not go away or a cough that gets worse over time. Second, coughing up blood or rust-colored sputum. Third, chest pain that is often worse with deep breathing, coughing, or laughing. Fourth, shortness of breath. You may also experience fatigue if cancer treatment damages healthy cells in addition to cancer cells. This happens as your body works to repair damage caused by treatment. How do we prevent lung cancer? The most important strategies aim to prevent people from ever using tobacco products and getting tobacco users to quit. Second, avoiding environmental and occupational exposures can also reduce lung cancer risk. Third, see your lung doctor right away if you notice any of the above symptoms. So what is tuberculosis? Tuberculosis or TB is caused by a bacterium called Mycobacterium tuberculosis. The bacterium usually attacks the lungs. TB bacteria spread through the air from one person to another. When a person with TB disease speaks, coughs, or sings, TB bacteria can get into the air. People nearby may breathe in this bacteria and become infected. Once infected, the inhaled bacteria will deposit in the lungs and will multiply. So what are the symptoms of tuberculosis? First, persistent cough, which may last for more than 2 weeks. Cough with blood in sputum, breathing difficulty, night sweats, and fever for more than 2 weeks. Tuberculosis is the second most common cause of death among communicable diseases. Nearly 70 Filipinos die every day from this curable disease. So what are the myths and facts regarding TB? First, it is hereditary. The truth is, genetic plays no role in disease transmission of tuberculosis. Second, it is passed through utensils. The truth is, it is passed through coughing and sneezing of an infected individual. Third, TB can be fatal. The fact is, if the patient completes the full treatment module, then the disease is fully curable. Last, TB is a disease of people in low socioeconomic class. The truth is, TB can affect any people regardless of socioeconomic class. For those who have tuberculosis, it is important to adhere to medications or treatment plan. Not adhering to medications can cause multi-drug resistance. Drugs for TB will no longer be effective because the bacteria causing the disease have already developed resistance. So how do we prevent tuberculosis? First, wear a mask if a family member is known to be infected. Second, keep the most vulnerable kids or aged persons away from the infected person. Third, proper ventilation. Fourth, proper cough and sneeze etiquette. And lastly, is to get vaccinated with the BCG vaccine. For information, you can visit this website. That is all for today. I hope that you learned something from us. Thank you and goodbye.